Hi guys, thanks so much for coming for the last session at the Bukit Puchong Marathon Running Clinic. If you guys don't already know, that was the second last session, and this Sunday will be our final session. So just a quick recap of what we did. We actually talked about injury in sports and injury recognition and prevention. If you want to be a sports person, doesn't matter whether you're a runner or a cyclist or anything at all, as long as you want to be an active person, there's always a risk of getting injured, and the best way to manage it is to actually find out more about your body, know when and where you can seek help. And if you remember, last week we had a professional physiotherapist that came and joined us. So this is Jess. She's from Apple Physiotherapy here in PJ Palms. You can check on Facebook to find out more about Apple Physio, but Jess is here to do a recap of what we did the last week.
Okay, thanks Karen.
No problem.
So first of all, just a recap, and I mentioned last week, right? There are three things I usually answer when I see my patient in my office. They will always ask me, why do I in pain? Why do I get the pain? And when can I run again? And how do I prevent this from coming back again? So make sure you ask these three questions when you see your physiotherapist. And I also talk about knee pain. Foot and ankle pain is the two main killers for the runners. Yeah, and we also would like to find out how do you know whether you're at high risk of getting knee problem and ankle problem. So the first one will be, how do you know whether your knee is good or not? I need to do some demonstration. Like for example, stand on your one leg, right leg, and then you do single leg squat. You should be able to do effortlessly for at least 15 times without pain. Likewise, do it on the left side, 15 times. So if you have pain when you're doing this, this is the time where you should start looking after your knees and then seek professional help. Yeah. So the next one will be foot and ankle. So foot and ankle, still on one leg. Why always one leg? Is because when you run, you always land on one side of your body at a time only. You don't run with two legs together. So for the ankle, you need to do single leg hopping 15 times. This is for right side, and left side 15 times as well. You should be able to do pain-free. Yeah, so these two.
Alright, cool. We also talked a bit about taping, right?
Yes.
Maybe you can share, is taping like a preventative measure? That means you tape to prevent injury, or do you tape to manage injury after that?
For me, I normally do assessment before I decide how to tape my patient and the runners, because if you don't know how to tape correctly, I do have patients who come to me who tell me they get the pain after taping. Because the tape actually works. If you don't tape it correctly, it actually gives you adverse effect on your joint, so it may cause more problem if you don't know how to tape it. Unless you're already familiar with the taping technique, your physio have already taught you how to tape it, then you can use the same technique over and over again. We normally use it to manage the pain, because runners sometimes they get injured, then they only come last minute, and we cannot get rid of the pain before the actual race comes.
Yes,
so we will tape them so that they can perform as good as they can. Yeah. So manage and prevent for us.
Cool. So Jess has been helping many athletes, runners, marathon runners, ultra runners, triathletes, cyclists. So if you ever have any problems, please come and look for Jess at Apple Physio. Alright, that's all we have. Come for our final grand finale this Sunday at Bukit Puchong. I'll see you there.